All right, we're going to talk about recovery position, and why we use recovery position is if one of my patients has needs an open airway, needs a patent airway, we call it, and they're basically making an effort to breathe, but they're unconscious enough so that the tongue is falling against the back of the airway and is blocking it off. What I need to do is alleviate that blockage by rolling them over on the side and getting them into what we call the recovery position. It's going to go pretty simple like this. I can go ahead and put my patient's arm up, and you can roll them to yourself or away from yourself. I tend to roll them away from me because a lot of times these guys might puke, and I don't want them puking on me, so they're going to go that way. Arm goes up here. This keeps the head in a neutral inline position. I'm going to grab them by their belt. I'm going to hold underneath the base of their skull and roll them forward nice and easy. And then as I do that, I'm going to go ahead and untuck his arm here. I'll take the top leg, bring it over, get him up in a kickstand position. I can move his hat, get him forward a little bit, and what that's doing is that's bringing the tongue off the airway by gravity so that it lets blood, drainage, vomit, anything else go that way versus going back into the airway, causing them to aspirate that, causing bigger problems down the line with an aspiration pneumonia. So quick, simple, easy. Anybody with that's unconscious with airway issues needs to end up in this recovery position.